therapeutic approach to panic disorders according diagnosis of traditional Chinese medicine. View options. I want to click.
Doctor, when you want to change to the next slide, please inform us.
Please tell them. Yes, please tell us.
Yes, I
Yes,
have, and I need to change the slide. It's okay. Motivation for the selection of this disease as the research theme is a high prevalence condition, 2 to 3%. Affection relatively frequent in the current population appeared since the young age. Occupational disability, because patients have reduced mobility, make extensive use of medical services. They have many more visits to the family doctor and receive many more prescriptions for psychotropic and non-psychotropic drugs. They have a large number of hospitalization and diagnostic treats. And the stigma that accompanies this mental illness and allopathic psychotropic treatments. Patients have catastrophic attitude to the side effects of allopathic medicine, increased risk of suicide, treatment a long time, and the complete remission. Allopathic medicine only succeed in improving and inducing psychotropic dependence, which invalidates patients. How to change the slide, please?
Yes, we will change.
Yeah. What else does traditional Chinese medicine bring to the study and treatment of panic disorder? According to the TCM theory, panic disorder is just one of the manifestations that can occur in several syndromes. The study of these syndromes led us to identify some etiological factors that are not known by Western medicine. The TCM diagnosis also takes into account the constitutional type of each patient, which facilitates the identification of sensitivities and helps to prevent possible aggravation. The therapeutic results of TCM treatment methods are superior to Western medicine treatments because they address each syndrome as a different entity and because they restore the body's balance. Change, please. Regarding the treatment, two ideas emerge. Allopathic medication can itself generate one of the syndromes that it also manifested by panic disorder. So they can aggravate an existing imbalance. This idea I had after I studied the effect, biologic, inner cellular effect of the medication for panic disorder. And I studied the unpleasant effects of this medication. And this helped me to share in two categories this medication, as you will see as follows. TCM therapeutic methods, for example, acupuncture, TCM phytotherapy, dietetics, massage, qigong, do not treat panic disorder, but the general imbalance of the body. By balancing, all manifestation of a syndrome will attenuate or disappear. Is as in mathematics. If you have all the terms for an equation, you will have the expected result. Since we are trying to correlate the Western medicine theory with TCM theories, we start from the characterization of panic disorder according to DSM-5 criteria, overlapping these criteria with syndromes that include symptoms of panic disorder according to TCM criteria, which are, we have 4 syndromes: kidney yang deficiency, kidney and spleen yang deficiency, kidney and lung yin deficiency, kidney and liver yin deficiency. Following the detailed comparison of the etiological factors, the pathophysiological pathway, and the treatment principles, we find possible solution when the aim of the treatment is not only relieve symptoms, but the balance of the 4 syndromes considered different diseases. Change, please. Change. Yes, thank you. Can we achieve better results by approaching patients with both diagnostic and therapeutic panic disorder according to TCM theory? We notice that there are 2 yin deficit and 2 yang deficits, each involving the imbalance of another organ or group of organs. That means there are 4 different diseases. So we have 4 different diseases with special etiology, pathophysiology, and treatments. It is easy to conclude that the treatment of Western medicine, the same for any patient with panic disorder, can be wrong in at least 50% of cases. And it's another problem we'll see. The patient has not only panic disorder, he could have other diseases, and Western medicine gives for these other treatments. Change, please. And change. Why it is important to integrate TCM knowledge in general medical practice. How can TCM help achieve superior results in treatment and healing? TCM in the panic disorder field has 4 different diseases with different etiology. We have kidney yang deficiency. This table is about etiology, causes of these diseases, which are, as you could see, very different. For kidney yang deficiency, we have emotional problems that disrupt the Shen spirit, prolonged exposure to extreme cold, excessive sexual activity, chronic disease. For kidney and spleen yang deficiency, we have excessive consumption of raw and cold foods, prolonged exposure to humid and cold climate, rich and or irregular meals, poor nutrition, lack of physical activity. For kidney and lung yin deficiency, we have excessive worries for a long time, chronic pathology of lung yin deficiency, irregular meals taken late at night, overwork, external or internal dryness, yin deficiency in the stomach, intake of warm substances, food, medicine, alcohol, smoking, caffeine. For kidney and liver yin deficiency, we have anger, frustration, depression, kidney deficiency in overwork, excessive sexual activity, depletion of organic fluids, in fever diseases, prolonged blood loss, wrong medication. We have liver blood deficiency, low protein diet, significant bleeding, poor inherited constitution. You see different causes. Some of them has nothing with the causes from other syndrome, but all of these patients could have panic attacks, which is the crisis in the field of panic disorder. And they receive from Western medicine same medication. Change, please. Why it is important to integrate again, but causes of panic attacks in Western medicine. For this is important to integrate TCM and traditional Chinese medicine, because some of the causes are same, but they are not identified as causes for different diseases. We have genetic inheritance, major stress, temperament, more sensitive to stress or prone to negative emotion, certain changes in brain function, different mental and behavioral disorders, certain condition, depression, post-traumatic stress disorder can promote panic attacks. Consumption of certain substances. Among the substances associated with panic attacks are nicotine, caffeine, alcohol. These are causes of panic attacks. And we have another table with risk factors, also recognized by Western medicine: family history of panic attacks or panic disorder, major stress in life, such as the death or serious illness of a loved one, a traumatic event, such as sexual abuse or a severe accident, major changes in life, such as divorce or the birth of a child, smoking or excessive caffeine intake, history of physical or sexual abuse in childhood. You see, just few of real causes for syndromes who could generate panic attacks. Please change. Thank you. Why is it important to integrate TCM knowledge into general medical practice? How can TCM help achieve superior results in treatment and healing? This question are like a leitmotif. Panic disorder can occur as a manifestation of the 4 syndromes mentioned, 2 of which are young, deficit, and the other 2 are in deficit. We compare the manifestation of the side effects of allopathic medication commonly prescribed to patients with panic disorder and found that selective serotonin reuptake inhibitors and serotonin and norepinephrine reuptake inhibitors cause indeficiency. Benzodiazepines cause yang deficiency. This demonstrates that in the absence of knowledge of TCM syndromes, the psychiatrist may prescribe a treatment that aggravates the syndrome, or when prescribing drugs from different groups, they only compensate for each other's side effects. Change, please. TCM syndrome can manifest in different parts of the body, generating different diseases from the point of view of Western medicine, diseases that the medication for panic disorder can aggravate. But for TCM, after we establish the diagnostic of syndrome, it must establish the diagnostic of which part of the body manifests more this syndrome. And same patients could have panic disorder, but in the same time or one after other could have different diseases, but in TCM is only one disease. Like kidney yang deficiency could generate chronic bronchitis, asthma, syndrome of irritable bowel, menstrual disorders, amenorrhea, infertility, impotence, prostatitis, epilepsy, diabetes insipidus, epicondylitis, myopia, central choroidoretinitis, optic nerve atrophy, retinal pigmentary degeneration, tinnitus, deafness, obesity. Kidney and spleen yang deficiency could have chronic enteritis, gastroptosis, duodenal ulcer, irritable bowel, epilepsy, cardiac neurosis, hemorrhoidal disease, amenorrhea, uterine prolapse, optic nerve atrophy, retinal pigmentary degeneration, eyelid ptosis, obesity, gut. Kidney and lung insufficiency could have chronic bronchitis, chronic laryngitis, asthma, febrile syndromes, osteoarthritis, lumbar discopathy, insomnia, depressive syndrome. And kidney and liver insufficiency could present high blood pressure, seminal emissions, intercostal neuralgia, muscular cramps, stroke, epilepsy, migraine, diabetes, gut, scapulohumeral periarthritis, dysmenorrhea, myopia, central choroidoretinitis, optic nerve atrophy, and all of them could develop panic disorder. Change, please. Conclusion. Inner junk, this is the name of syndrome in TCM, according to the rules of TCM, panic disorder is only one of the possible objective manifestations. A junk, a syndrome, manifests itself in all structures of the body, down to the cellular level. We have to judge not the organ, the macro organ inside of the body when we speak about kidney, heart, liver, spleen, or other. We have to think which of this organ as function in TCM correspond to part of the inside of a cell, of each cell. As the kidney correspond to a nucleus, spleen correspond to mitochondria, and so on. And if they have an unbalance, they begin in the cell level. Then they develop a disease of organ of a special part of the body. 3, the patient's predisposition given by this constitutional type, but also the presence of specific etiological factors contribute to the severity of the symptoms. 4, TCM treatments, acupuncture, phytotherapy, massage, diet, and so on, are addressed to the whole body. So repeated balancing can improve or even cure a condition, but more importantly, can prevent serious illness. 5, the TCM specialist should be an indispensable collaborator of the allopathic specialist, both in curative medicine and in preventive medicine. And I want to say it's very, very important that all practitioners in health field to know some information about Chinese diagnostic, because in this way they could cover more than problems of the body, and maybe the treatment will be less, and to his action to be straight in the place of unbalance. Change, please. Thank you for your attention, and please forgive me for this my problem with technique, computer technique. Thank you very much, and if you have a question, I'm ready for it.